Assalamu alaikum everyone. Today we are going to study neurodevelopmental disorders, and neurodevelopmental disorder is going to be our first disorder in which we shall be discussing all the DSM-5-TR oriented changes. So according to DSM-5-TR, there are seven major types of neurodevelopmental disorder, and the first one is intellectual developmental disorder. The second one is communication disorder. Third one is autism spectrum disorder, ADHD, specific learning disorder, motor disorder, and the seventh one is other neurodevelopmental disorder. So all these disorders have been slightly revised in DSM-5-TR. There are some minor changes in diagnostic criteria, specifier, differential diagnosis, and other subtypes of or subcategories of disorder. So let's get started with the first disorder, which is intellectual developmental disorder. So according to DSM-5-TR, in intellectual developmental disorder, an individual or a child has deficits in intellectual and adaptive functioning in social, personal, and practical domain. These three domain, which is social, personal, and practical domain, you can see the significant deficits. For example, the criteria defines these deficits in three categories. First of all, if we talk about the intellectual deficit, that means the person is not able to solve the problems. He cannot think abstract constructs. For example, the things which are in front of his eye, he can just conceptualize those things, but once the things are disappeared from eye, he or she cannot think about that clearly. He cannot reason things. He cannot use logical thinking to fulfill any gaps. So these are considered as intellectual deficits. Furthermore, if we talk about deficits in adaptive functioning, so first of all, he fails to meet the social cultural standards. Like, he cannot easily get adjusted in his social context. He doesn't know how to make communication with people, how to manifest emotion in the right place, in the right direction, and he does not understand his social and personal responsibilities. So again, you can see there are majorly deficits in two domains, which are intellectual deficits and deficits in adaptive functioning. So apart from this, another diagnostic criteria which has been reported is the onset start during the developmental period. And you know what is developmental period? From birth till 18 years of age is considered as developmental period. So since birth to 18 years, he can if he depict any kind of intellectual or adaptive functioning oriented deficit, so we can categorize or give him or her diagnosis like intellectual developmental disorder. So there are some severity level which are known as severity mild, moderate, and severe. Even after there is another one which is profound. So when we give the diagnosis, we see either he is suffering from mild intellectual developmental disorder, moderate, severe, or profound. And we categorize all these severity level in three domains, which are social, personal, and practical domain. For example, if I conceptualize a person is is have the severity level mild in social domain, so we can say he can keep connection, he can meet other people. Maybe there are some deficit in communication, conversation, but that are not much immature as per their age criteria. And but you can see some deficits in making limited understanding in social situations, social judgment, and their social judgment is immature for age, and the person is at risk of being manipulated by others. But in moderate, severe, and even profound stage, you can see the social deficit to a high extent. Same goes for personal and practical domain. Like in personal domain, he cannot organize, nurture, prepare food, and he does not know the management, and the recreational skills are so poor. So like in this kind, the severity level becomes adverse with the mild to moderate, moderate to severe, and severe to profound. They start behaving very poorly. In practical domain, like practical or even conceptual domain, they also show deficit in school work and in their day-to-day living. So again, we can give diagnosis accordingly. So intellectual developmental disorder, there are some specifiers. Like you can only give the diagnosis to an individual as intellectual disability based on the severity level in adaptive functioning rather than IQ. If a person has low IQ, you cannot categorize him or her in him as a person with intellectual developmental disorder. But there must be adaptive functioning oriented deficits in their life. Furthermore, there are many other disorders which somehow look similar to intellectual developmental disorder. For example, if a person has particular genetic and medical condition, so he must be suffering from neurocognitive disorder, which is different from intellectual developmental disorder. So if a person has genetic or medical condition, you cannot diagnose him as intellectual developmental disorder. So if there are some deficits in communication and learning, so again intellectual developmental disorder oriented diagnosis cannot be given, because only deficits in communication and learning doesn't specify their adaptive functioning. It's just communication oriented gaps, which is another disorder. So again, on autism spectrum disorder, as all of you know, people uh, people manifest communication oriented deficits, and again there are repetitive behaviors. So but in intellectual developmental disorder, there are no repetitive or impulsive behaviors, so we cannot again give the diagnosis of a person who is having poor communication along with the repetitive or rigid behavior. So these are differential diagnosis, and differential diagnosis mean when two disorders look similar in nature and we become a bit confused which diagnosis should be given to that particular person. So in intellectual developmental disorder, if the person is having these three conditions, we cannot give him or her the intellectual developmental disorder oriented diagnosis. So, in intellectual developmental disorder, there are two more conditions like global developmental delay. When a person or individual is below 5 years of age, and it is not clear why, if he is suffering from intellectual developmental disorder, or there are some other, intellectual deficits, poor communication, and it's not easy or possible to carry forward the assessment, so we can give them the diagnosis of global developmental delay. But if a person is above 5 years of age, and again the assessment is not possible due to multiple cognitive, behavioral, or genetic deficits, and it's hard to give them diagnosis, so we can give them unspecified intellectual developmental disorder diagnosis. So it is neurodevelopmental disorder, and I hope this is clear to you. Okay, so let's get back to the second disorder, which is communication disorder. And in communication disorder, there are multiple other disorders as you can see on screen, communication disorder represent any kind of deficits in language, speech, and even communication. And any kind of deficit either in language, speech, or communication leads through different kind of communication disorder. As the first disorder is language disorder, and in language disorder, a person persistently experience difficulty in the acquisition as and use of language. Neither he can produce words or not he can use language, and due to the deficits in comprehension, because he couldn't understand the words, and therefore they have reduced vocabulary, and word knowledge and use both are very limited, and they have limited sentence structure. They do not have ability to put words and word ending together to form sentences based on the rules of grammar and morphology. They do not know any grammatical structure of the sentence. Furthermore, they have impairment in discourse, like they do not have ability to use vocabulary and connect sentences to explain or describe a topic or even a series of topics. So therefore they also um, manifest many words production oriented error. And again, the big criteria represents that the language abilities are below than chronological age, like other person of the same age can produce better words, and they can they can use acquisition and use of language very well, but as compared to their peer fellow, these people having the above mentioned deficits. So onset during developmental period, always this language disorder occurs during the developmental period, and it is not attributable to hearing or other sensory losses. There are no other sensory loss. Only then we can give them diagnosis if they are having any kind of medical or hearing loss. So we cannot give them diagnosis of language disorder. Again, there are some differential diagnoses. We should not give a person a diagnosis of language disorder if he has normal variation in language. Some people do have language deficits, which is considered normal because some people achieve milestones late and they start speaking very late. So we should not give them the diagnosis of language disorder. And if a person is having any hearing and other sensory impairment, so again he cannot be given a language disorder a diagnosis. Intellectual developmental disorder, if a person is suffering from IDD, so again language disorder cannot be language disorder cannot be diagnosed in the person. Same goes for autism, neurological condition, even language regression a person is having. So the diagnosis of language disorder cannot be given. Similarly, the second disorder is speech sound disorder, and this disorder also have four diagnostic criteria. First of all, a person experiences persistent difficulty with speech sound production that interferes with the speech intelligibility or prevents verbal communication of message. Like they cannot produce sounds which are related to the accurate sound word production, and because of this deficits of producing deficit in producing sounds, they experience limitation in effective communication. And again, the onset starts during the developmental period before age of 18, and it's not attributable to congenital or acquired condition. Sometimes it happens that person biologically have some deficit to produce sounds, but sometimes it also happen due to any accident or injury. He has lost the ability to produce sounds, but in such scenario we cannot give them diagnosis of speech sound disorder. Again, normal variation in speech are very common. Normal variation of speech, regional, social, cultural, or ethnic variation of speech should be considered before making the diagnosis. Like sometimes people cannot, produce some sound because their culture is different. Maybe their language is different. So, like a Urdu speaking person is, bound to speak in Pashto or any other language, or any Pashto person is bound to speak Urdu. So, in such circumstances, if he is taking time in sound production, or if his communication is not effective enough, so we cannot give him or her the diagnosis of speech sound disorder. Apart from this, if a person is having any hearing or sensory impairment, and he cannot be given the diagnosis. Even if a person has some biological problems, structural deficits, or if he has muscles weaknesses or selective mutism, in all conditions we cannot give them the diagnosis of speech sound disorder. The differential diagnosis in all type of speech disorder are more or less similar, so we should not be spending much time on it. Okay, then the next this language disorder is childhood onset fluency disorder, which is also known as stuttering. So, in this disorder, a person experiences disturbances in normal fluency and time patterning of speech that are inappropriate of the individual age and language skills. It persists over the time and are characterized by a frequent or marked occurrence of two or more of the following symptoms. For example, he speak in sound and syllable repetition he experiences, and sometimes sound prolongations of consonant as well as vowels. For example, if he want to speak some word, so the vowel or he gets stuck on vowel or any consonant word, and it takes lots of time to complete a single word. Sometimes he speak broken words, pauses, take long pauses within a word, and he's audible or silent blocking. He take unfilled pauses, and which also a very weird in situation. Furthermore, they use word substitute to avoid problematic word. They start thinking what word should I use in the replacement of this word, because this particular word is hard to speak. So you can find such gaps as well. So the word produces with an excess of physical tension, like whenever they are trying to speak any word, you can see the physical tension to pronounce the word. And furthermore, monosyllabic whole word repetition, like they also experience whole word repetition. They continuously speak the same word again and again to find some words, so that they can speak easily. Furthermore, when they are pronouncing the word, significant anxiety about speaking or limitation in effective communication can be seen, which can adversely impact their academic, occupational performance. And again, like all the neurodevelopmental disorders, the onset start at early developmental period, and furthermore, in adult, the onset fluency disorder may start after 18 years, and this disturbance is not attributable to speech, motor, or sensory deficits, and because it's not due to any deficient, so that we can give the diagnosis of childhood onset fluency disorder. Okay, if we talk about differential diagnosis, so sensory deficits must not be present while giving this diagnosis, because disfluencies of speech may be associated with a hearing impairment or other sensory deficits, which cause difficulty in producing sounds, or in speaking fluently, or also if a person is having normal speech disfluencies. We all experience normal speech disfluency. Sometimes we're not fluent in our in few topics, so yeah, it depends on area of interest as well. The disorder must be distinguished from normal disfluencies that occur frequently in young children, so we should be careful about that. Furthermore, specific learning disorder with impairment in reading. So sometimes it happens a person experience disfluency only during reading. So we should understand that it is just a reading impairment, not a dyslexia disorder. Sometimes if a person can speak by two languages, so he also experience dyslexia issues. So again, due to bilingualism, we cannot give him or her diagnosis of a neurodevelopmental disorder. Sometimes due to medication side effect, adult onset dyslexia and Tourette syndrome, which is a vocal and repetitive Tourette's disorder. So again, we cannot give them diagnosis of childhood onset because these are biological conditions. So I hope it is clear to all of you. Uh, let's move to next disorder, which is a social pragmatic and communication disorder. In social pragmatic and communication disorder, the person experience difficulty in social use of verbal and non-verbal communication in multiple areas. For example, deficits in communication for social purposes, like he cannot greet, he can't share information which is appropriate for social context. Also, he experience disability to change communication to match context or the need of the listener. For example, if he's speaking differently in a classroom than on a playground, so you cannot find this type of variation in his conversation. Okay, furthermore, they also experience difficulty following rules for conversation, sometimes storytelling, and they also experience hurdle such as taking turn in conversation, rephrasing when misunderstood. So you can see such deficits in them. Apart from this, you can also see difficulty that they don't understand what is not explicitly stated. Maybe they make inferences and they don't know what has been said to them. Okay, the deficits result in functional limitation in effective communication. So their communication wouldn't be effective, and it will cause academic, personal, social, you know limitation. And furthermore, it is not attributable to any kind of medical condition, neurological condition, or maybe not attributable to any other neurodevelopmental disorder. So these are the disorder which can be categorized in communication disorder. So we are done with communication disorder. There were four basic disorders which we have studied. Now again, let's get back to the third disorder, which is autism spectrum disorder. So autism spectrum disorder, as we all are familiar with it, but again there are some changes which we need to understand. So in autism spectrum disorder, as you know, a person experience persistent deficits in social communication and social interaction across multiple contexts. For example, he must have deficits in social emotional reciprocity. For example, if you are sharing your sad emotion, maybe he cannot exchange the same emotion if you are, greeting them, so they cannot, greet you in the same way as you did. Or maybe they are not good in, continuing, maybe no, it's sure that they experience failure for normal back and forth conversation, and they reduce sharing interest, emotion, affect. And furthermore, they also experience failure to initiate or respond to social interaction. Whenever you try to interact them, they won't show, a much good reciprocity. Secondly, they also, you can see also the verbal and non-verbal communication oriented deficits, like you can see the abnormality in their eye contact, body language, and also you feel that their gestures are not good enough. Furthermore, you can see that they don't understand relationship. For example, they feel difficulty in sharing imaginative play, in making friends, or absence of interest in peer. They do not, know how to keep their relationship healthy. The second criteria, it was the first criterion. All three conditions must met while the diagnosis. And as far as the second criteria B is concerned, so they have repetitive restricted pattern of behaviors, interest, and activities as manifested by at least two of the following. The first one, they have stereotype repetitive motor movement. For example, they speak the same words again and again, and if it's about motor stereotypes movement, so they start flipping objects, they throw and pick the same object or try again and again. Furthermore, you can also find insistence on sameness, like they cannot tolerate inflexible routine, and they always prefer to follow the same pattern, same greeting ritual, and the same routine set. And if they experience any change in their routine, they often react weirdly. Also, they have fixed interest, and they, abnormal in intensity or focus, strong attachments or to preoccupation with unusual objects. Furthermore, they are hyper or hyporeactivity to sensory input. For example, if you will bring something unusual or maybe colorful, they will get distracted, maybe due to some sound, some smell, or visual fascination with lights and movement. They will easily get distracted, and it will be hard for you to make them again become get their attention again in the same point. So criteria C tells that how the symptom starts early developmental period, and it affects their social, occupational, and other areas of functioning. Furthermore, these are not better explained by any intellectual developmental disorder, global disorder, or any kind of disorder. So now this was the criteria of autism spectrum disorder, but there are some specifiers as well. For example, uh, it is whenever you are giving diagnosis to any child or even adult for autism spectrum disorder, so you need to know either he required either very substantial support, or requiring just support, like he need very substantial, just substantial, or just requires support. Also, you need to specify if the autism spectrum disorder is accompanying intellectual impairment or any other language impairment. If it is accompanying or not accompanying, in both circumstances you need to specify. Also, you need to specify if any general genetic or medical condition is associated with this diagnosis, any catatonic behavior is associated. If yes, so you need to specify that, because specifiers are new in autism spectrum disorder, which tells us that these symptoms or diagnosis criteria is present but have some specifiers, some specific types, so there are multiple differential diagnoses because autism spectrum disorder have many symptoms like ADHD, intellectual developmental disorder, language, mutism, stereotype movement, Rett syndrome, symptom associated with anxiety disorder, OCD, and personality oriented. Symptoms are also similar. So it is very important to identify how it is not attention deficit hyperactivity disorder, it is only autism spectrum, because in attention and deficit there is hyperactive behavior, there is attention deficit, but again autism spectrum also has attention issue, like as I said, when they get distracted, so it's very hard for person or clinician to bring their attention back to certain points. So yes, symptom overlaps, but you need to specify how it is different from them. So intellectual disability or intellectual developmental disorders, have some adaptive functioning. So but in neurodevelopment, in autism spectrum disorder, we focuses on only to communication or repetitive or rigid behavior. So similarly, all disorder have one or two symptoms, but autism spectrum disorder have set of symptoms, and in each set there must be two, three condition which needs to follow or need to meet. Otherwise, we can't give autism a specific diagnosis. The next disorder is ADHD. Again, attention deficit hyperactivity disorder is also a very important disorder, and there are also some changes, like specifiers have been added and some other differential diagnoses have been revised. So we need to understand it is a persistent pattern of inattention and hyperactivity or impulsivity that interfere with functional development. If we talk about inattention, so there are multiple types of inattention, and at least six symptoms between among the following must be met while giving the diagnosis of inattention. For example, a person must often fail to give close attention to details, or also they make careless mistake in school work and other activities at work and multiple settings. They make careless mistake. They also experience difficulty in sustaining attention in task or play activity. They easily get distracted, and they do not stay focused during lectures, conversation, or lengthy reading. They also not, they seem as they are not listening and they are not paying attention. Also they experience difficulty in organizing task activity, and their work feels disorganized, and they often avoid or dislike or is reluctant to engage in tasks that require sustained mental effort. So these deficits also found to be very prevalent in people with ADHD. Also, so these are a symptom, in at least six of the following must be met while giving the diagnosis. And the other symptom is hyperactivity and impulsivity. Again, six symptoms must be met. For example, if you can see, they often play with their hands or feet or sit in squarium seat. So this is a sign of hyperactive or impulsivity. Often they leave seat in situation when remaining seat is expected, or sometimes they cling in the situation, and when it is not appropriate, they often unable to pay attention in playable activity, and you will find them on the go every time. They are ready to they are ready for motor movement, high motor movement every time, and they talk excessively. When you ask questions, so they will give you multiple answers, often blurs out an answer before your question is completed. Furthermore, it's hard for them to wait for their turn, and they interrupt or intrude others while they are talking or doing something, and they try to engage in things without permission of other people. So they engage in such activities, and apart from hyperactivity or inattention, there are some other criteria. For example, the several inattentive or hyperactive symptoms were present prior to the age of 12 years, and these symptoms must be present in two or more settings. For example, either they are at home, school, at work, with family or friends, or in any activity. So in at least two settings their symptom must be present, and there is a clear evidence that symptoms interfere, reduce the quality of their social, academic, and occupational functioning. You will see the deficit. They are not able to maintain their relationship, their academic grades are poor, and their personal and occupational functioning also poor. And these symptoms do not occur exclusively during the course of schizophrenia or any other psychotic. Like if a person is ADHD, he must be having just ADHD symptom, not other disorder must be there. And there are some specifier, like you need to specify if he has combined presentation mean if he has inattentiveness and hyperactivity or impulsivity. But if inattention is predominant, so you need to specify that the person has ADHD, but predominantly inattention is more prevalent than hyperactivity. Or even if the hyperactivity is more prevalent, again you are supposed to specify. So if you need to also specify if it is a partial remission, like the symptom have been disappeared for certain period of time and now you can see a few symptoms again. So also you need to specify if the person is suffering from mild ADHD, moderate, and severe. As far as differential diagnosis is concerned, so you need to specify if the person is suffering from ODD, O is missing. So oppositional defiant disorder, like in oppositional defiant disorder, a person may resist work or school tasks that require self-application because he resist conforming to others' demand, and he act a bit rebellious. In attentive explosive intermittent explosive disorder, he also have high levels impulsive behavior, but there are not inattentiveness, so we cannot give this diagnosis. If a person is having other neurodevelopmental disorder or some specific learning disorder, because as we said, they are not able to learn because of inattention and hyperactivity, they do not sit at seat for a certain time, so their learning must be poor. But still, on the basis of poor learning, we cannot give him or her the diagnosis of ADHD. So these were the criteria of ADHD. Now let's move to the motor disorder. So there are some specific before motor disorder, there are some specific learning disorder, and in learning disorder a person must have difficulty in learning and using academic skills as indicated by presence of at least one of the following symptoms. For example, inaccurate or slow and effortful wording, like they cannot read single word aloud. Maybe they if they pronounce or read single words, so they pronounce it inaccurately, hesitantly, frequently they seems like guessing the word, but they do not know exactly what the word is and have difficulty in sounding out the words. So also they experience difficulty of what is read. Like for example, someone else is reading, he won't be able to understand what is he reading, and they even don't know what is the sequence, relationship, inferences between the text, and they also experience difficulty in spelling, difficulty in expressions, and difficulty mastering numbers sense, like the numerical or mathematic skills also found to be poor, and all these symptoms affect their academic skills, and their skills are beyond far beyond their chronological age group, and which affect their personal, social, and academic functioning. And these are not better explained by intellectual disability or any other neurological disorder, but it is just a specific learning disorder, and they do not understand the instructions or inadequate educational instruction they experience. So in specific learning disorder, um, there are some specifiers as well. For example, you can give them a specification with impairment in reading, like if he have word reading in accuracy, if he has reading rate of fluency, or if he has reading comprehension. Sometimes they can read but they cannot understand, sometimes they can understand but they cannot read. So you need to specify what kind of problem he or she is suffering from, and if you also need to specify the impairment in written expression. For example, if they have spelling inaccuracy or accuracy, they have grammar and punctuation oriented problem, they have number memorization or accurate math reasoning, you need to specify. Also, you need to specify if he is suffering from mild, moderate, or even severe form of learning disorder. So it was another neurodevelopmental disorder which we have covered briefly because we have less amount of time. Therefore, I am covering it, a bit fast. But if you have any question at the end of the lecture, you may ask. Okay. So next disorder is motor disorder, and in motor disorder we have multiple types of motor disorder, and the first one is developmental coordination disorder. In developmental coordination disorder, the acquisition and execution of motor skills substantially below, like they cannot move appropriately as compared to their peer group or the people who have the chronological age group. So, and because of this, they manifest some clumsiness, like they drop or bump into the object. Sometimes it feels like they are not holding something appropriately and slip from their hands, and their motor skill, like using scissor, riding a bike, or even in sports, they perform really poor, and their motor skill deficits are persistently interfere in their daily living, in their school, academic, vocational, pre-vocational, layer and play oriented activity very adversely. And again, its onset starts in early developmental period, and their deficits are not better explained by any intellectual developmental disorder or visual impairment. Is just a motor disorder which affecting their personal, occupational, or academic life. The other motor disorder is stereotypic movement disorder, in which a person involves in repetitive, seemingly driven, and apparently purposeless motor behavior. For example, they keep shaking hand, their body feels rocking, they indulge in self-biting, hitting on body, sometimes self-biting, and their repetitive behavior again interfere with their academic or other activities. And it also start in the early developmental period. The repetitive motor behavior is not attributable to physiological effect of a substance or even neurological condition. It's just due to their stereotypic movement, not other neurodevelopmental disorder. So you need to specify if the person is having self-injurious stereotypic movement, including with self-injurious behavior or without self-injurious behavior. Also, you need to specify if it is due to genetic or other medical condition or not, and uh, you know, um, what is the severity level? Is it mild, moderate, or severe? You need to specify that. Okay, the next one is tic disorder. And in tic disorder there are three types of disorder. For example, the first one is Tourette's disorder, in which both multiple motor and one or more vocal tics have been present. Two multiple motor and one vocal tics must be present, and age before 18 year it must be start, and the frequency of the symptom must be at least for 1 year, and disturbance should not be attributable to any psychological effect of a substance. But in persistent and provision in persistent, single or multiple motor or vocal tic have been present. Previously, both must be present here. Single, multiple, or vocal tic. Either vocal or either multiple tic must be present during the illness. All other criteria are same. Like it must be prolonged for 1 year, and it must be, the onset must be before 18 years of age, and disturbance is not attributable to any psychological effect of a substance. That means the person is not taking any medication, and it's not the side effect of medication but a disorder completely. In provisional tic disorder, single or multiple motor and or vocal tics. Like in this disorder, single or multiple motor and vocal tics must be present. The other criteria is completely same as Tourette's and persistent motor vocal disorder, like age of onset not attributable to other medical condition, and symptom must be present for at least 1 year. The all symptoms are same. So these are the tic disorder. Apart from these three types, there are some other specifier. For example, we need to specify tic disorder if we give the diagnosis of specified tic disorder, where the when the clinician give diagnosis and they tells us that due to this particular reason we are not sure which type of tic disorder is this, so we diagnose a person with the specified tic disorder. But unspecified tic disorder can be given a diagnosis if there are no reason associated, and what the clinician have not given any reason why they are giving this particular diagnostic disorder diagnosis, so it is known as unspecified type of disorder. uh, the last category is other neurodevelopmental disorder. And in other neurodevelopmental disorder, again there are two types, like other specified neurodevelopmental disorder and non-specified neurodevelopmental disorder. As we have studied the six type of neurodevelopmental earlier, but there must be some other types. So if we are not able to identify what are the other types, so and we can give a reason, because it's a combination of multiple symptoms, therefore we are not sure which kind is it, so we can give the other specified neurodevelopmental disorder, which will be illustrating the cluster of disorder. And if non-specified neurodevelopmental, when we do not know the reason why these cluster of symptoms are there, and which symptom must be categorized first to give certain diagnosis, so we can give non-specified neurodevelopmental disorder. So, students, these were the neurodevelopmental disorder, and I tried my best to cover all 7 disorders in a specific time period. Therefore, you must be having some clarity, and in case of any ambiguity you can ask your question now, because I'll be giving you the clear answer. And I hope next time we shall be starting schizophrenia and other spectrum disorder, so I shall be trying to cover it in 1 hour. So similarly the pattern will go on and on. So now you can ask your questions. Thank you.